Good morning, Rob. Summer's approaching us.
Yeah, happy June. It's summer.
Usually, yearly, we talk about what we should do and not do for the summer with the heat coming up.
It's summer your favorite season.
Summer is my favorite season. I don't mind the heat. I look for the heat
Yeah.
in the winter.
About the fourth week of July, I'm looking forward to the fall.
I'm good up till August, I think.
I'm going to try to heat train, though, this year. Like sauna more to get myself adapted better for the heat.
I love that.
Well,
along with your cold
I'll let
plunges.
you, yeah, I've already adapted for the cold, so I'll
This
let
is
you know
not
what
just
happens.
about the health of your teeth. It's the health of your,
exactly.
your whole well-being, your whole
Everything's
body.
adaptable, right?
Right.
Everything's modifiable. So with summer and all times, people are always asking us, what should I do for this or that?
Hydrate, hydrate, hydrate. That's usually what we say, right?
And we also were going to talk about a few of our favorite products, but I guess you always go into this, and I like how you talk about the summer stuff. What else do you talk about with summer, with what you're eating?
You're leading into something here. I talk about my Fuji water, which I love. I don't like people drinking a lot of Gatorade for sports during the summer. I tell them to get away with that. If you're going to sip Gatorade, follow it up with water. You know, if you look at the tennis players at the match, I mean, they're not doing this because of the sugar, but they drink a little Gatorade or some type of energy drink, and then they follow it up with water, right? Because of the sugar level, and it's really not healthy for your body to hydrate with just an energy drink.
Right. An energy drink typically is for the moment when you're performing, right? Like an athlete, you said it best, if you're in a race, in a game, and most of us aren't doing that. If you're playing a sport for an hour or two, you don't need to supplement with energy types of things or have an energy drink during or afterwards. Your best thing is just hydrating with electrolytes. And there's a lot of electrolytes out there right now on the market that are sugar-free, right? So I like Noon or Element. They're sodium, magnesium, chloride balanced, so the same osmolarity or the same concentration of things in your blood. So it makes the water more absorbable.
Well, I like the little tablets also that you can add to the water. That's you like the Noon tablets. You know, whenever I've done like the bike tours, you have a marathon coming up, right? I mean, you're not going to be drinking energy drinks for 4 hours while you're running, mostly water.
So yeah, I think hydrating with a carbohydrate-free, but yet replacing your magnesium, sodium, and chloride is a very beneficial thing to do. The number one deficiency is magnesium in our country from a supplement standpoint. So by doing something like that throughout the summer is really good. It'll help to keep you healthy and feeling good. Now you won't wake up tired and groggy or crampy if you're active, right? And then sweets, parties, events, people have desserts, people have more fruit, more sugary drinks. Right, you think of summer, you think of like cocktails with stuff and fruit.
Or even more salty foods, potato chips, right? You get more carbohydrates, plaque sticking to your teeth more readily because of that.
And if it's hotter, you might feel you're breathing more through your mouth and you're more dehydrated. So hydration is an important thing throughout the summer, and what you're ingesting, as always, is important.
You know, and I like to tie it into people traveling a lot, right? And we always talk about traveling with your dental products, not to slack off on your home care when you're on vacations.
And so don't do it during the summer either when you're busier, days are longer. I mean, sun's setting at like 8:30 in a few, so you want to make sure that you don't slack off. We commonly get asked from patients, what is your favorite X? Like, what is your favorite this or that or whatever? So when you think about things that you like to do or a product, what is kind of like one of your, the past 6 to 12 months you become more opinionated on or that you really think is important for everybody?
So that's easy for me. I don't like to change products if something's working for me. I can go from my shampoo to my cologne to everything in life. So my dental products really don't change too much. From a toothbrush, we always speak about I'm going to use my Sonicare or my Oral-B toothbrush. I'm a big Pro Enamel user. I love Pro Enamel toothpaste. It's made by Sensodyne. The abrasive factor, it's SLS free. SLS is a plastic little particles that's in our shampoo. Some people have allergic reactions to that. They could develop canker sores. So Pro Enamel has none of that. It's a low abrasive factor. But I must tell you, I did try to switch, and I alternate back and forth with a new brand that we ordered, which was called Boca. There's no fluoride in it, nanohydroxylase, so it has it remineralizes the tooth by adding phosphate and calcium to the teeth. So a lot of the people that like those homeopathic products and don't want fluoride in their toothpaste, this is a safe product.
Yeah. The studies compared fluoride toothpaste and hydroxyapatite show that they're equal at preventing cavities or tooth decay. I really like the hydroxyapatite toothpaste. I use Risewell also at home. I use it on my kids because my kids are little kids and they end up swallowing the toothpaste. So I don't want them to swallow extra fluoride. Trying to figure out how to get my kids not to swallow because it tastes good. Like, yeah, does that make toothpaste doesn't taste good maybe. So hydroxyapatite toothpaste are great, like Mark said.
So it gives you the natural effect, but a little bit of the scientific data that's tied to that.
Yeah, it doesn't bind to teeth as strong as fluoride does, but studies, and there's not a lot out there yet, but it does show some promising results. But it has to be nano hydroxyapatite, and it has to be more than 10%. Unfortunately, there are a lot of hydroxyapatite toothpaste that are not nano. Even, it's my biggest complaint, like Risewell, they came up with this, and it's called their pro form is the nano, but they sell a regular form that's just regular hydroxyapatite of a larger particle size. It's unabsorbable.
So why do you think they still sell both of them?
Marketing, I guess. I guess it sells. It's more expensive. So the problem with nano hydroxyapatite is more expensive to make than a larger size hydroxyapatite. So they're selling it to sell it, but there's zero therapeutic benefit. It might as well not even be in there. It kind of bothers me that they sell it, to be honest.
Don't lose sleep over it.
You're laughing at me. I'm like, well, be honest.
So my second product, which is probably something I've been using over the last 3 years, which I like, is a tongue scraper. Particularly, I like Dr. Tongue's, Tungs. I think it's the best one on the market. They make one that's copper. Copper is known to have antimicrobial factors. So basically, you're scraping the bacteria off your tongue. You know, this bacteria builds up a thick film on your tongue. So the plaque will stick to it, make it more susceptible to periodontal disease and tooth decay. So I think it's a great part of your everyday routine to use a tongue scraper, remove the bacteria from your tongue. A lot healthier. A lot of the bacteria on our tongue is causing bad breath also. So for me, that's a game changer. I like it.
I think that like, you and I overlap so much with this. And so for my favorite things are complementary to yours, right? I think but what's common is that what people aren't sometimes considering is that if there's a problem in one spot in their mouth, it can travel throughout their mouth and affect it, right? So if you have one tooth with a cavity, that tooth decay can increase the rate of decay other places in your mouth. So by scraping your tongue, and I love that you like harp on this so much because I think it's so important, is that the bacteria is in your mouth. So to clean that is so important. And so for me, my thing that I've talked too much about is probiotics because they're all hand in hand in maintaining the microflora of your mouth and the balance of good bacteria. And so the things that I'm stronger on this year than I was last year would be like alkaline water. And I have one right here. This is Flow. 8.1 pH. This one's actually flavored, which is kind of cool. They're everywhere. The one thing I like about this is this: you can absorb alkaline water better than you can neutral or acidic water. So if you're drinking the same quantity of acidic water to alkaline water, less will get into your bloodstream of the acidic water versus the alkaline water. It's more absorbable. But also it's more gentle to your mouth. Most of the bacteria that cause problems in our mouth live in an acidic environment. So if you're locally keeping your mouth in a more basic environment, alkaline basic, you're going to help to combat some of the bacteria. So Mark's into cleaning out that bacteria mechanically with the tongue scraper. And if you're also maintaining an environment that good bacteria live in.
And you're introducing good bacteria with, with
and
the probiotic.
Then the probiotic we'll get into. Yeah. Then if you use a probiotic, Burst is the brand we love. You're really doing as much as you can to prevent these problems. The other product, I couldn't really pick one, a xylitol product, xylitol gum and mints, using them. So you gotta be careful because it has to be 100% sweetened with xylitol. And that helps to kill the bacteria that cause tooth decay and no other bacteria. It's found to be healthy at the dosage that it's in a gum or mint. And you could use this after meals when you're on the go, you're at a party. Instead of brushing your teeth, you can use that to balance off the acid from beverages or food or after a meal. I have some in my car in my bag.
So it's good in between meals. It's almost cleaning your mouth with the piece of chewing gum if you don't have a toothbrush.
Yeah, it's probably the simplest, best thing to do after a meal is to chew or use a mint that's sweetened with xylitol.
Stimulates your saliva, right?
It stimulates your saliva, and it just needs to be exposed to your mouth for a little more than 5 to 10 minutes to have the therapeutic effect. To me, between alkaline water and doing that, if you did that after every meal and throughout the day, you would have a pretty profound effect on your health. I don't have any studies to back that up, but I believe that it would do something to help to really manage the bacteria in your mouth, good versus bad. The only other thing that we love is a toothpaste we have here. It's called GC1. It's a fluoride calcium hydroxide toothpaste that you can't buy over the counter for whatever reason. I'm not sure why they do that. You can only buy from dentists. And that toothpaste does outperform all other toothpaste in studies. But because of, you can only get it through a dentist, it's to me, It's less accessible.
Is it ADA approved?
It's ADA approved, yeah. Yeah, so although it's the best, it's not the easiest to get. It's not cheap. It's expensive. It's a small tube for about $20 to $30.
They would need one of the bigger companies to pick them up.
GC. GC is a huge dental material company out of Japan. They don't make consumer products. They make some of the best
Dental products, yeah.
We love their products.
So they understand the scientific aspect of the dentistry, right?
Beautiful products, but they don't do direct to consumer. So I guess they just want to keep one sales path or whatever you call that. I don't know. I'm a dentist. I don't know you. I don't know what you call. I don't know from where they make it to where it goes. Yeah. We get a lot of questions about labs and where things are made. As prosthodontists, we specialize in prosthetic dentistry, and we end up making things outside of people's mouths that go into their mouths, right? Fillings, inlays, onlays, crowns, bridges, implant restorations, things that Mark and I call in our practice indirect restorations, because they're made indirectly for your mouth, opposed to a direct restoration that is done directly in your mouth.
Which is a 1-visit procedure as opposed to usually a 2-visit procedure for indirect restoration.
It's an interesting thing. I think that there's a lot of behind the curtain action in this topic.
With different labs.
With different labs where things are made. Most restorative dentists have to deal with labs, and it's probably one of the most challenging things to deal with for the average dentist.
Could be the biggest headache if things aren't going smooth. Because sometimes it's not under your control, right? We control the case, we make our provisionals, our temporaries proper, but if we don't have the proper lab support to support what we're doing in the practice, we're not going to get a great end result.
So the average regular size practice, they'll take an impression, optical or digital ortho impression material, and they send it to a place, to a person or a company or a lab.
Could be local, could be in China.
Could be anywhere, especially digitally. You email a file, and then they make something and you receive that back, probably with a little control. You kind of ask for it. This lab makes their version of it and gives it back to you, and a lot of trust involved in that relationship. And so patient will come in and you'll have this thing ready for a patient that was made somewhere else by somebody else. And the dentist in the average situation, just it's kind of the nature of the industry, the profession, and the workflow of everybody, is that these pieces get made for them. And it's probably a lot of the old think their version of it. There's different versions of labs, right? You and I can send to a lab to get something made for $39, $39.99, right? We get those pamphlets versus the same exact thing for $600, $700, $800, $900 for just that piece being made. It ranges from over $1,000 to just over $10. And some of these labs will offer a free piece of equipment if you make a certain amount of business with them, right? They'll give you a $30,000, $40,000 intraoral impression scanner if you send all of your impressions to them.
So these are labs that are interested in volume of dentistry, pumping out as much lab work as they can to satisfy the dentist at a cheaper rate because of that, usually.
Yeah. When we were talking about it, you could say there are labs that are more individual people. So there are labs that make up individual person somewhere in the world that they do the work with a small team. So it's them and a couple people that are doing the work. Low quantity, high control, call it boutique if you want. I don't know. High quality takes a little more time probably, and they're located somewhere else, versus commercial labs. And there's kind of like two or more versions of
high quality commercial labs, and then there's what we call mills that are just pumping up as much dentistry as possible.
That are just called these centers that just mill out things, and they're done a lot and they're cheap. And then of course we're lucky enough to have in-office ceramists and technicians. So right now we have 3 in-office ceramists in our office. They just focus on ceramic restorations, the lab work around that, and supporting us for things that we do around those.
So talk about the advantage of an in-house ceramist, right? What is our biggest challenge in dentistry? Is probably to do one single crown restoration in the front of someone's mouth, and the adjacent teeth are 2 or 3 different shades, different colors. So you could send that to 10 commercial labs and you'll probably get 10 crowns back, and maybe none of them will match. You could take all the photos in the world without someone there. Occasionally we need our ceramists to come in the room and custom stain it to match it to adjacent teeth. Opposed to doing a smile makeover, you can make them all the same color. But it's not just about color. It goes into fit, into shape. I find now in-house ceramists gives us more control over our cases.
So much more control. And they can come to us any point, any time, and talk to us all day long. I think what happens in a commercial lab is the lab gets paid on how many units they make in a day, how many crowns they make in a day, right? So a ceramist can make 5, 10, 20, 30, 40 crowns in a day. And that's how many times that lab is getting paid. So if I'm a ceramist or a lab tech and I have 20 crowns in front of me to get done today, and I have a question on the third crown, I have to try to talk to that dentist, but I'm trying to work on the other crowns, and we're juggling all that. I call their office. They don't get back to me. There's another day. They don't call me today. The next day, the next day. So when they're trained invariably to pump out units and pump out crowns, they figure I'll do it this way.
They're not all perfect.
They're not all perfect. I love that this goes out to patients beyond our practice. I want patients to understand that there's a price correlation with what they get in terms of quality. And it has to do with the time that's involved through the entire process, through the appointment from the doctor to shape that tooth, that restoration, make the impression, to then have the lab make it in the time, the constraints that they need, and then the time to fit it and to actually say, this isn't perfect, let's make it again.
There's a lot of businesses that are very similar to ours, that you'll find this across the board with different aspects. I mean, even if you compare restaurants, like a fast food restaurant compared to 11 Madison, right? You can get a piece of chicken here, you get a piece of chicken there. It's not all created equal.
I think it's a good conversation to have with people, with their dentist, when they're facing an implant restoration, a tooth restoration. It's like, how are you making this restoration? What is your lab support? And like, what does that mean?
Don't you love that? Then you can go into exactly explain how you make the restoration and show them the lab work.
I know some insurance practices that offer, like, this is the lab that is covered through your insurance plan, or you can pay the surcharge to using a better lab, and that's out of pocket. And it has to exist, right? We don't have a solution for you. I haven't figured that one out yet. How to deliver great dentistry at a cheap fee would be nice, right? Not there yet. So I think you're thinking about how your things are made, right? How your things are made that you're going to receive in your mouth. And of course, we're edging slowly. It's not as fast as we all want, but for in-office, same-day made restorations, we're not there that for our taste, they can be executed perfectly, properly every time. We have some friends that are really good at it, but it takes a different type of entire environment and person, and it's a much longer appointment while you're making it and this and that. And so we're not quite there yet.
You could still get, what you're saying is some of this work, I'd rather send it out to a lab than mill a restoration at this point in my office. I feel like the lab's going to give me more control over it.
Yeah, consistently, for sure.
The interesting about that is with the digital workflow, we could do a digital scan to make a tooth, and that tooth can already start being fabricated before the patient even leaves the office. I'll give you an example. I have a patient coming in from Dominican Republic on July 1st. Now, I had to schedule this in advance with my lab. He's coming in for an implant impression on July 1st, and I'm inserting the implant crown on July 3rd, 2 days later, which is amazing with the digital workflow. With the regular impression, it would take a day to send it to a lab, a day to get it back.
To mill everything.
It'd be impossible to do that.
There's zirconia and everything.
And most labs aren't really set up to do a restoration in a day or two, but if it's planned in advance with the right lab, it can be done.
Yeah, it's the benefit of having an in-office lab.
We'll even accelerate that even quicker.
So just think about the process of what you're receiving, where it's a hip replacement or a tooth, whatever it may be.
So Rob, talk about, summer's coming, you have a patient who's coming in for a cleaning, and they say, Rob, I'm going to Europe for 2 months over the summer.
Forget a cleaning. I'm going on vacation. I need you to check so I don't have any problems while I'm on a safari or wherever I'm going.
Right. I'm going out of the country. I don't know if there's any dentist near me.
Or whatever it may be. Yeah. I'm going on a new job for a year or this or that. So we get that a lot, especially in New York. It's a very transient location. People are in, they're out, they're moving around. It's kind of the nature of a big city.
Well, sometimes they're moving for business for a couple of years. I'm relocating in London for 2 years. Won't have a dentist. What do you recommend?
Right. It's almost like the same thing that we get when patients are considering starting bisphosphonates. It's like you need to start, just make sure you're up to date with everything. Make sure your radiographs are up to date. Make sure you've had a cleaning recently. And then you want to make sure that you just evaluate your teeth, your mouth, and see if you're having symptoms of everything. Symptoms of temperature changes, hot or cold. It's something new. If you've had a sensitivity for 20 years, it's not relevant.
Pressure sensitivity, pain on biting, anything that's questionable, you want to get that dentistry completed before you travel.
Right. You want to be thorough about what's happening and what's new or what's different than it used to be as a baseline. You want to make sure your radiographs are up to date. I do think the best way of evaluating the health of your mouth is a cleaning with an exam, because you and I can evaluate a clean mouth better than a non-clean mouth, number one. And then the other part about that is the hygienist is cleaning around every tooth. They're cleaning every pocket, every surface of every tooth. So they're feeling it also. So having those two eyes on a comprehensive approach to your mouth is the best thing you can do before you travel. If there's a specific thing that has changed, then you should get that addressed also. Like the other mindset is, well, I'm going away. I'll put this off until I get back. And then day 2 of their vacation, they bite into a baguette and snap a tooth.
So that's why I said anything that's questionable probably should be treated prior to traveling.
Probably just good to get everything up to date and report things that are different.
Or you see a few patients that have not the most ideal restorations, but there's no decay and they're regular. They come in every 3 months, every 6 months. And you can watch those restorations. Say, you know what? No problem. We'll evaluate again in 3 months. If you're going to travel for 3 months, maybe that's not the safest thing to do. Maybe you want to address that prior to traveling.
I think the most common complication that I get, tell me what you think, from my patients is that I'll get a text from somebody like, my tooth just broke. And then my next question is, can you send me a picture? Does it hurt? Right? So I guess when you have something break, you should reach out to us. That's when something happens and you're away, reach out to us, because we'd rather help to kind of funnel that and direct you and manage it properly. I had a patient recently who an old crown popped off, and they were, again, it was like on their like first, second, or third day of like a 3-week trip where they were somewhere, and there was no sensitivity. So I said, just leave the crown out of your mouth. If it doesn't hurt, you're not going to damage anything. You can't make it worse. Send me a picture, of course, so I knew. I said, eat, brush it, and we'll deal when you get back.
I would stop you there for a second. If it's in a place that could be readily treated and it's a well-made crown.
Yeah, if you're in Germany. Or,
I
or Switzerland.
I want to get that crown
yeah.
re-cemented, because if it's out of the mouth for 2-3 weeks, chances are it may not fit back in the mouth and it may have to be remade.
We won't talk about which countries we wouldn't support you going to the dentist, but there are some places in the world, very developed, wonderful places. They may have the best cheese in the world, but you might not want to go see a dentist there. Just leave it at that.
They have good cheese in Florida?